Injury and surgery are hard. Hard if you have all of the support of a national team, hard if you are in a healthy, loving environment and relationship, hard if you have all the resources available to you. Why? It's a threat to your existential self. It's a loss and a small death of the way you interact with your community, interact with your recreation, how you self-identify. And for a lot of us, we choose exercise because makes us feel good. It's how we cope. And suddenly those things can be altered. How I interact in my local gym community. Again, let's just take a second and say, wow, this could be harder. And it may be harder than you think. The key to a successful surgery is really just planning. Can I control what I can control? How do I maintain my sense of agency and my sense of efficacy? Throughout this protocol, you realize, man, there's a lot of things I can do to begin to focus on maximizing my healing time. Keep in mind that you're a brilliant, brilliant healing machine. Your body will heal. You will get through this. Remember, the sort of 3 cardinal lies are, I can't stand this. I'm afraid it's going to get worse, and I'm afraid it's never going to end. I promise you, you will get through this surgery one way or the other, because your body's a healing machine. But secondarily, I just want to remind you that you either heal at the rate of a human being or you heal slower than that. And that there's a lot we can do to appreciate that the typical bar is very low. That most of the time when people have surgeries, their goal or the goals of the physician and the medical establishment is not to have them go back and set a PR, that sounds great, but rather to have them return to activities of daily living that are normal. Our surgeries are set up to just get us back and functional. We also have to appreciate that the heavy lifting and the burden is on us. That the medical system and even the physical therapy system is not set up to return you to higher degrees of function, or at least the same degree of function. If that was the case, your rehab would be 3 to 5 days a week at the clinic, and you'd be covered in sweat and doing well body training, and at the end, hitting your squat PRs. So that's not the case, and I think it's unrealistic for us to sort of try to appropriate this acute medical post-surgical model, which is helping you to manage infection and get you functional with your idea of what you think you should be able to do again. The tissues are never going to be normal again. That's okay. You have enough buffer, you have enough tissue capacity in the system where you can be extraordinary and only ever be at 90% of your true capacity on the rehab of that tissue. Keep in mind that while they'll never be normal again, we're always in process of normalizing, that we turn over our skeletons every 12 to 18 months, and all our connective tissue turns over every 12 to 18 months. So we're always in process of turning and rewriting the structures of our body. The real issue here is getting your brain to prepare you, to think that the tissues are safe and they can handle the loading. Oftentimes, that's the last hurdle and sort of stepping stone for getting athletes to return to sport, is to get their brains to believe that that knee or that ankle or that shoulder can take the loads and speeds. Our healing processes, our training processes, the support we have is an order of magnitude more powerful than even it was 10 years ago. The way we're able to manage pain and congestion, the way we're sort of able to supplement what it is we do, our outcomes are blowing away the traditional protocols. But you cannot erase your physiology. So make sure that you're keeping a notebook. This is a wonderful time to sort of watch what your processes are and be curious about that. Try to avoid slipping into self-sabotage or self-soothing techniques like bourbon that are going to help you cope in the short term but maybe delay your healing, maybe aren't as healthy, right? Remember, you're only human, that there's a lot of wiggle room in your physiology, but it's a wonderful time to refocus on the things that matter. How's my nutrition? How's my body composition? How's my water, right? And remember, we're not advocating for this is a great time of weight loss. This is not another stressor. Divide all of your sort of life into, is this a stressor or a tonic? Am I giving myself permission to make sure I'm sleeping enough and moving enough, or am I adding additional stress? If you take on crazy workloads, if you take on crazy aerobic demands as you're trying to heal, I just want you to see that this healing time can be just like another plate or a weight vest that you're wearing all the time. In short, I guarantee you will have an incredible outcome for yourself. Why? You're a human being. You're set up to heal and set up to be 100 years old. If you've heard people talk about the gift of injury, gift of surgery, it's not a gift, but it is an opportunity, absolutely, to learn a little bit more about ourselves, to address movement practices and chase down funny goals, to improve sleep, improve quality, and frankly, talk about your feelings. Again, this protocol was intended to fill in some of the gaps that we have perceived in our traditional rehab model and rehab processes. By all no means are any one of these things written in stone. Take what you will, discard the rest. Hopefully we've been able to give you some different ideas so that you can appreciate that you're not just a surgical person laying on the couch for indefinitely and hope you come back. That is not our intention. Our intention is to help you be able to maximize your time during this rehab process. Thank you very much.